and help us clear some of these myths of somebody saying I'm healthy. Now, a health insurance is a contract, an agreement, such that a prepaid health insurance plan, a prepaid care is provided for individuals. When I say prepaid, I mean you pay a certain amount of money upfront ahead of time, whether you are sick or not, so that when the need then arises, you would not need to make any payments out of pocket. All you have to do will be to walk into a health facility and receive care, because you have already made some payments ahead of time. So there are different contracts, different arrangements, depending on what obtains. Some people pay annually, right? They pay a certain amount of money every year, and once they've made that payment, once they are ill, all they have to do is to walk into the health facility and receive care. Of course, it depends on the plan that you subscribe to, right? So
that would mean there are different plans.
Yes, there are different plans.
Could you give us examples rather?
Okay, so you know that treating cancer, right,
it's
and
expensive.
Treating malaria is not the same thing. So you don't expect that because you paid maybe 100,000 naira for the year, for instance, that when you have a terminal cancer or maybe a kidney dialysis, you would then go and get treatment for kidney dialysis, when all you paid was probably 100,000 naira for a year, or 50,000 or thereabouts. So it's graded such that the payment you make determines the service that you have access to.
Okay.
Right? So the payment you make determines the service that you have access to. If you want to have access to maybe, let's say, kidney dialysis or certain cancer treatments, of course you would expect that the amount of money you pay will be higher for it to cover that particular treatment. And then apart from that too, sometimes you could have full coverage or partial coverage for some kind of situations. It could be that, okay, this payment you are making covers 50% of what you would have ordinarily incurred on that particular situation. So there are different plans, and they all have different financial implication, and consequently service that you have access to.
Now, you made mention of, when the illness, eventually happens. What happens if it doesn't happen? I mean, say I pay an entire year worth, right? Maybe I'm paying monthly or weekly or quarterly, right?
Yeah.
And the entire year runs out and I didn't need it.
Okay, so let's look at it from this way. If I pay a certain amount of money, right, my premium for health insurance, most likely when I fall ill, the costs will usually be more than I have been, be more than I paid for the year, 100,000 naira, 200,000 naira or thereabouts.
Yes.
By the time I check the number of times I fell ill in the year and the services that I received, it usually is more than the amount of money that I paid. So what happens is that everybody pays, right? But we know that not everybody will fall ill. So the money that those who did not fall ill paid will then be used to augment the payment for those who eventually fell ill. So imagine a situation where 100 people pay for health insurance. At the end of the day, only 30 fell ill, for instance, right? But those 30 that fell ill, the amount of money they paid is smaller than the service that they received. So it means that the extra came from those who eventually didn't fall ill. So what happens is that if you pay and you don't eventually fall ill, your brother, your sister, your uncle, your nephew, whoever
Can access.
Yes, will benefit from your payment. So more or less, humanity is the winner, right? And
What
the health
happens
system,
if none of them does, though?
somehow somebody.
So there's no refund in this thing.
No. It doesn't make any sense to do a refund. if you do a refund,
Can
then
you carry over?
it defeats the purpose of health insurance. Sorry, let me make
Okay.
it. Let me make
Okay.
it point. Yeah,
Okay.
if you do a refund, it defeats the purpose of health insurance. Now, remember that you didn't fall ill this year does not mean you will not fall ill 5 years later. Right? Now, you've said there are people who can stay a whole year without going to the hospital. But in the next 5, 10, 15, 20 years, it is possible that you would eventually go.
Does it accumulate?
No. However, when you eventually go, it is somebody else's payment that will be used to augment the service that you receive. So let's say 2024, I paid and I didn't eventually fall ill, right? In 2027, I also paid and I fell ill. Now, the service that I will receive that 2027 will be more than the money that I paid in that 2027.
But then it's
meaning somebody else's payment for 2027 was used to augment my own for that particular year.
Help me understand this, Mr. Martins.
Okay.
If I made a payment in early 2023 is over, right?
Yeah.
This is 2024,
Yeah.
and I haven't made any payments yet.
Yeah.
Can I walk into a hospital and still get
Okay, so that's why I said
care?
it depends on the contracts you have. Some do annually. I think I mentioned that some do annually, right? So after every year you have to renew. Some do maybe every 6 months, some do quarterly, depending on the plan. Some could even do over 2 years. So it depends on what the particular HMO is offering you, the particular contract that you have. So if it's 1 year, then after that year you have to renew.
All right, now let's talk about the
needs. You made said
Yeah.
something like, okay, so now let me share a story. There's this lady, it's a true life story. A lady shared the story somewhere in Nasarawa State, that at a point her mom was ill, so ill, critically ill, that they spent every kobo that they had and there was still no way out. It was clear that this woman, they will not be able to afford the care that their mother needed. They've borrowed money, sold properties, done everything to raise enough money, and they could not, right? So one day somebody visited and asked the woman, but madam, I thought you work in so and so government establishment. The woman said yes. And then the man said, if that is the case, you have a health insurance coverage.
So it's possible that there are people that have this, and they're not aware.
Exactly. They are not aware. A whole lot of people, depending on your place of work. Some employers of labor just deduct it from your salary and remit, right? And some that you are entitled to this particular service. So a lot of people don't even know the breakdown of all that is deducted from their salary. They just know that,
at the end of the month,
exactly,
this is how much I'm receiving.
Exactly. They have no idea of what has been deducted and what it entitles them to.
True.
So that man told the woman, that means you have a health insurance card. The woman said she is not aware. So because that man had raised the issue, they had to follow up and discover that truly the woman had health insurance coverage because she has been paying over the years. Guess what? Because of that, the provider then took responsibility for the woman's care and provided every penny that was needed to save the woman. And then the lady that was sharing the story said the amount of money that the health insurance outfit provided was by far more than her mother had ever contributed. And if not for that intervention, the woman would have died because they would not be exactly. So you see that somebody that had the mindset of I don't fall ill and all of that eventually came and benefited even more than she had actually contributed to the pool. So at the end of the day, it's a win-win for everybody. I would encourage everybody to get a health insurance coverage. I have mine, and it's in the interest of everybody to get for himself.
Before we came on air, we were having a chat about this, and you mentioned the legalities of it. Run us through it. I don't want to box this particular aspect to questions and employers, employees, individuals. Just run us through the legalities of this.
Okay, so even before now, of course, we used to have the National Health Insurance Scheme running this. But in May 2022, then President Muhammadu Buhari signed a law, National Health Insurance Authority Act, repealing the previous NHIS Act and then bringing this on board. And one of the standout things in the law that the president signed in 2022 is that health insurance is now compulsory in Nigeria, right? Before,
compulsory for
everybody, every citizen and resident of Nigeria is compulsory. Before May 2022, right, it wasn't compulsory. But after that an amendment which the president did, we now moved from National Health Insurance Scheme to National Health Insurance Authority Act, right? And then when it was National Health Insurance Scheme, the head was the Executive Secretary. Now is Director General, in a bid to give more powers to the agency to be able to function as fully as it should. So anybody who does not have a health insurance coverage in Nigeria now has run foul of Nigerian law. So yeah, of course, you know the argument last week of civil and criminal
law and all that.
And all of that. But the important thing is that you have violated the
law.
Yes, if you don't have the health insurance coverage. And then even before the new law, which came on board in 2022, every employer who has a certain number of staff is mandated to provide health insurance coverage for everybody under his payroll. Not to talk of now that it is compulsory.
Now compulsory for every individual.
Exactly. So at the end of the day, it is in the best interest of everybody to go and get the health insurance coverage.
Is every hospital, now I've been dying to ask someone this question, does every single hospital in existence offer health insurance? Or is it specific to certain hospitals? And then how do you navigate around, or my hospital, or the hospital I prefer going to, uses this and that?
Okay, so if you need a health insurance coverage, you would go to a HMO, Health Maintenance Organization. You pay to the Health Maintenance Organization, and then the Health Maintenance Organization, the HMO, remits to the health facility. So the HMO is the link between the individual and the health facility, and the hospital. Now, every HMO has a list of health facilities that they have a contract with. They have an understanding, a memorandum of understanding, whatever with. So you select one hospital from the list that your HMO presents to you. So maybe you would prefer a hospital that is closer to your house, so that if there's an emergency, you can easily go there. Or if you think you want one closer to your place of work or wherever, but basically you make the choice based on the list that the HMO has provided for you. So that is the way it works. Then if at any point you feel that you want to change for one reason or the other, you could still change your health facility and pick another one still within the list that your HMO has provided.
Well, that's pretty interesting. Now, I know that there are certain terminologies that are very new to people.
Yeah.
You already mentioned the Health Maintenance Organization, the HMOs, which is like the most common one that is being thrown around and what they do.
Yeah.
We also have TPAs.
Yeah.
And we have all those terms. Let's talk about them. Tell us what to expect. Because, can I just walk into how do I know how to navigate getting? I think that's what I want to ask.
Okay.
How do I navigate getting health insurance?
Okay, so we've just mentioned the HMOs, Health Maintenance Organizations. Most times, if you need a health insurance coverage, you go to the HMO, and then the HMO serves as the bridge between you and the health facility. So you know your HMO, and then the HMO knows the health facility. And then, of course, there's a Mutual Health Association, right? In some communities, local communities, let's say my village, they may choose to get the health insurance coverage for everybody in my village as a whole may go to. So they can have a mutual health association assisting in that. You could also have things like a third-party administrators. So even the National Health Insurance Authority can get some, of course, from the name, third parties, more like a go-between to play certain role. It could be in terms of sensitization and awareness creation or whatever. So those third parties administrators are also there as a go-between between the individual and just to provide all the necessary information that needs to be out there. There are things like capitation. So when you pay to a HMO, right, the capitation refers to the amount of money that the HMO pays to the health facility, to the hospital, every month. So that is called capitation. Because, and then there's also premium, which is what you pay to the HMO. So you pay to the HMO premium, and then the HMO pays to the health facility capitation.
Capitation.
Yeah. So there are different terminologies, as the need arises. There are things like a fee for service, right? Under certain instances, a situation may arise where you have to make a payment that was not initially covered, right? That then becomes fee for service. There are things like per diem. There are instances where maybe on referral, right? I have an agreement with the HMO and this particular hospital, but my health situation requires referral. Under such circumstances, I could pay for bed space. So that amount you pay for bed space on daily basis by staying in that facility where you were referred to then becomes the per diem and all of that. So there are lots of terminologies, that comes up in the course of doing the engagement.
Or say I am just an individual. I have my own business. I don't work for any organization, and I really want health insurance now that I've heard about it. How do I get access to that? Do I just go to, where do I go? NHIS? Where do I go?
Okay, so you can go to NHIS. Now NHIA, National Health Insurance Authority. Okay, so of course they have their office somewhere in Jabi, the Otaku Jabi axis. Those who are familiar with the Jabi Park, that junction, it's not too far from there. But you don't even need to go there, right? Not everybody needs to go there. But I'm just saying you can go to any NHIA office. They have a plan, gift ship. So even NHIA provides the health insurance service. Beyond being the regulator, they also provide services. So go to the office of the NHIA. They would be able to, you make payments, and then they will provide service for you. That's one. You can go to the office of any HMO. HMO is Health Maintenance Organization. There are so many of them. I don't want to start calling names because I'm not advertising any. There are so many HMOs. You can just Google it up. Whichever one you like, you can walk into the office of the HMO and request for it. They will be happy because that is even their job. They are supposed to look for you, but you have then come to them as a HMO. Even banks, you can walk into any bank, right? Go to the customer care and say you want this. Most banks have that facility because it's insurance. Insurance is something which even banks do and all of that. So you can walk into any bank, you can walk into any HMO, you can even walk into the office of NHIS, now NHIA.
NHIA.
Yeah.
And get whatever service it is.
Exactly.
Information you need.
Get the information, but basically they already have the plans. So you just, the information you would be getting is how much do I need to pay and what access will it give me?
I mean, there was a time I found out that you can pay as little as 1,300 naira a month to have access to healthcare. I mean, it's cheaper than one roll of shawarma.
Exactly. So you see what I'm saying? In the long run, it makes more sense just paying it.
Just pay.
So beyond NHIA, there's also the state health insurance agencies. NHIA is not national.
National.
Yeah. The law empowers the creation of state health insurance agencies. So those state health insurance agencies are mostly social. Some people call them state social health insurance agency. Most of them provide services at very affordable rates. You just mentioned 1,300 naira per month, right? So the State Social Health Insurance Agency provides the health insurance service at very affordable price. So apart from the Office of NHIA, now we've also identified FCT Health Insurance Scheme. And then if you go to any of the 36 states, it could be the name of that state health insurance scheme. Yeah. So you go to FCT Health Insurance Scheme or that of your state where you are resident, and also make very little payment. You just said 1,300 per month. Imagine if you've been doing that over, let's say, 3-4 months, and then you fall seriously ill, right? And
it doesn't have to be just you, right? It can be you and your family.
Exactly.
How do you prove it's your family? This is Nigeria.
So first of all, there is the limit to the principal and 4 beneficiaries.
Okay.
Right? The principal, the individual, it could be the husband, it could be the wife, and 4 beneficiaries. You can't have more than 4. In fact, and 4 children, right? The principal partner and not more than 4 children.
Well, it has to be children.
Okay, so once people be 18 and below. Once you reach 18 years,
you have to have yours.
Yes, you would have to have yours, because there's also a plan for those in tertiary institutions. So by the time you get to 18, generally people would have started moving into tertiary institutions. So you then have a plan that you would pay for. It's called the T-SHIP.
Okay.
Right? Tertiary Students Health Insurance Program. So you cannot be paying for T-SHIP and still be under you cannot be an adult and still be a child, or you understand? So if you are below 18, you would get services as a dependent of your parents, and then once you reach a certain age, you would no longer be a dependent, because you are now expected to start even paying for health insurance coverage.
We have about 2 more minutes to wrap up this conversation, and I'm really sad that we do, but I need you in these 2 minutes to just quickly talk to us about the health insurance under one roof, and then give us your closing.
Okay, so before now, there's this confusion of how health insurance works. Who is in charge? Of course, the private firms, the private HMOs, they provide health insurance service. NHIA does. The state's health insurance scheme is also there, and there's a lot of confusion on how the health insurance thing works. Even how many people are enrolled in Nigeria, it's even a challenge getting the figure and all of that. So the idea of health insurance under one roof is such that the National Health Insurance Authority is that roof. Everything health insurance will be under them. So if a private organization